Hi. Well, it is Thursday, March 26th, and I have not recorded one of these videos in over a week because things just got too crazy. So when I left off the last video that I made on Tuesday, March 17th, St. Patrick's Day, that was the day I drove into work because I was done taking Metro. And late in the afternoon, my company that I work for announced that they were closing all the review centers in DC and that they were working on getting approval for the projects to go to remote work. And we would find out subsequently if we got remote work or not. So I headed home that night, not knowing when or if I would start working again, but at least knowing that I didn't have to go out in public every day. So that was nice, but just heading home to an uncertain future. The next day, Wednesday, March 18th, my daughter was sick. She had had a cough for a couple of days, and she has asthma, and the cough was triggering her asthma pretty badly. That's how her asthma was first diagnosed back in the fall, right after Thanksgiving. And she's had a couple of flare ups since then, where she has a cold and a cough, and then it leads to the asthma flaring up. She didn't have a fever, it was just the cough and then the trouble breathing. But it got bad enough that she needed to go to the doctor. So my husband took her to the doctor, and she did breathing treatments there for a couple of hours, and her oxygen levels were not staying up between treatments. So they sent her to the ER. So she spent some time in the ER, and I was starting to forget the timeline now because it's so crazy. It felt like the ordeal felt like it lasted forever, but it was really only a few days. So she was in the ER and still having trouble keeping her oxygen levels up between treatments, and they were trying to decide whether she was going to stay the night. The hospital she was at was using their pediatric unit for COVID-19 patients, and so they weren't sure they had a room for her to stay in and that sort of thing. So they were kind of going back and forth on that. And then the last I had heard that they did have a room for her, they were going to keep her there overnight because she needed to continue the breathing treatments. And then suddenly, a few hours later, I get an update that she had developed a fever. It wasn't a very high fever, and it came down when they gave her medicine, but that was enough. She now kind of hit on all of the typical symptoms associated with COVID-19, so she was going to need to be tested for it. So the plan was to transfer to Children's National Medical Center in DC, where they have like a whole viral department, and they could run a full viral screen on her to see if there could possibly be a different virus to blame. And then if nothing turned up there, then they would test her for COVID-19. So that was really stressful. Even though we still didn't really suspect that she had it, just knowing that there was that possibility and that she was going to have to be tested and everything was just really, really scary. And I was really worried, and it was hard being at home and knowing that I couldn't be with her, and that if for some reason she did turn out to have it and tested positive, I wouldn't even get to see her at all. So very stressful. I didn't really sleep much Wednesday night, waiting to hear updates from what was going on. I was hoping that they would transfer her quickly and run the test quickly, and we'd have some answers. But she actually didn't make it to Children's until 5 or 6 in the morning. And then, more breathing treatments and getting settled, and then waiting a lot of the day for test results. And it was kind of a surreal experience for my husband to see up close and personal, what's going on in the hospitals and how they treat these patients, and how everybody had to get suited up in the protective gear to come in the room every time just to like check her vitals and to do her breathing treatments and stuff like that. There was like a warning on the door and stuff like that. But then finally, sometime I think late in the afternoon, a team of doctors came in without the protective gear, which was a good sign. And they told my husband that she had tested negative for all the viruses, the known big ones. So most likely it was just, like we thought initially, a cold with cough that triggered the asthma. So huge relief. But she still had to stay another night in the hospital because her oxygen levels were still dropping after her treatments, and she needed to be able to go 4 hours between treatments with the levels staying up. So she stayed overnight. We were able to video chat with her a couple times from home that day, which was nice. Technology helps sometimes in cases like that. And then the next day we were hoping to get to pick her up around noon, but discharge took like a really long time, and so we didn't end up getting home until like 4:30 in the afternoon. Meanwhile, I learned on Thursday that the project I'd been working on was indeed approved for remote work. And so like Thursday they were having people come in and pick up laptops, which I wasn't able to do because my daughter being in the hospital. But they agreed to ship it to me, which is nice. So by the time I got back from picking my daughter and my husband up at the hospital, my work laptop had arrived at home. So I had to immediately kind of shift into a different mode and get it out and get it set up and get logged in and get everything figured out. And then get set to jump right into working a full long day on Saturday, working from home. And it was really crazy just adjusting to my new position at work and doing it remotely and having no idea what I'm doing. And everything's a little chaotic, and like I'm trying to figure out what I'm doing, period. Meanwhile, the managers and other team leads are, kind of learning how to manage this remotely. There's just a lot to figure out, and we had some new reviewers, and they're asking lots of questions, and it was just kind of chaotic. So I could have worked Sunday too, but I asked to take Sunday off so that I could kind of focus on the family, and I had, big plans for kind of getting stuff organized because we had not been really doing school with the kids, or doing, like, the days had been completely unstructured. My husband had tried to kind of get things started Monday and Tuesday, but then once Beth was sick, everything just went haywire. So I thought, I was pretty certain already that they were going to be out of school for longer than initially thought. And so I knew that I needed to get organized. So that was my big plan. Now it's going to clean and organize all the stuff in the house and get all this stuff, all set for Monday. It did not happen. It was just another kind of crazy day with the kids. And my husband went back to work. And so I just didn't get as organized as I needed to, and then had to jump right into the work week. So Monday, Tuesday, and Wednesday of this week have been some of the most difficult days of my life, I think. Trying to work at home with 6 children around, one of whom is a toddler. It's really, really challenging, and I'm new at my position. I have all these additional responsibilities. I can't just work when I want to work and, put in half effort when I'm struggling or whatever. I've got to do the things that are expected of me and work hard. Because I'm new at this too, I kind of feel like I have something to prove, so that they won't think that it was a mistake to promote me. So it's just all this pressure. And there have been I mentioned technology being helpful at a time like this. It is, but it can also be a bit of a curse because we have all these conference calls and these WebExes, and there have been 4 of them a day, most days this week. Today I only had 3 calls, so that was a light day. And those are times where the kids have to be quiet and they can't bother me. And they've been pretty good about respecting that, but it just makes it even that much harder to kind of keep them under control the rest of the times because, they know that they can't bother me during those times. So then they want to come talk to me in between the calls, but then I'm still supposed to be doing other stuff at work, and it's hard with, to focus my brain, and, they still have to eat. Kids eat all the time. And they need assistance with things, and it's just really, really hard. It's been a really hard week, and it's felt impossible. And meanwhile, more and more shutdowns are happening, and the state announced yesterday that schools are closed at least through April 24th, which was not a surprise. Some states have already announced that they're closed for the end of the year. And the numbers just keep rising of the number of people that have the virus, and we're up to 4 deaths in Maryland. And the number of cases really spiked from yesterday to today, and it's scary. My husband's going to work every day, and we just don't know what's going to happen. I'm grateful to have an income, and grateful that we're all reasonably healthy at the moment. But, it's hard to even take it day by day right now. It's like take it hour by hour. There's so much about this that's hard emotionally, psychologically. It's hard for us. It's hard for the kids. They miss their friends. They miss the structure. They miss their activities. They're getting on each other's nerves so much. And we've had some crappy weather this week too, so it hasn't even been good get outside and play weather. And our house is too small. We're all like right on top of each other, and I can't even separate them. If I had a nice big house and every kid had their own like computer or iPad, I could send them all off to their own rooms and let them have screen time, and they'd be quiet and they'd be fine. But that is not our reality. So we're just getting by as best we can. And we're struggling like everybody is. I know it's hard for everybody right now. There's people whose work has been shut down, and so they're not working, so they don't have income, and their bills are still going to come due. So there's, those kinds of things. There's people who have to go to work, like healthcare workers, first responders, and stuff. And then, of course, our amazing, like, grocery store workers and such, who are keeping the rest of us functioning. So they have it hard. There's a lot of people out there facing really tough circumstances. And that's where we're at. Things have escalated like crazy since the last video that I recorded. And I'm sure that they will keep escalating. Things are going to get worse before they get better. There are already areas in our country, New York City, Atlanta, where the hospitals are at or near capacity, where some hospitals are having to borrow ventilators from other hospitals. And at some point that's not going to be enough because those hospitals are going to need them too. And the numbers just keep going up. So that's where we're at. And I think it might be a while before I have a more positive update. I will try to make videos more often than once a week. Having this many days in between was not my intent, but I literally have not had time to do this because everything has been so crazy. So I'll try to make another video tomorrow, and if not tomorrow, then the day after. And we'll just see where we're at. Stay healthy and keep breathing.